This is the Emergency Medical Minute.
Okay, so I figured I'd do a little bit of a ditty on NSAIDs. So what does NSAIDs stand for? Wonderful. Non-steroidal anti-inflammatory drugs. And as we've got ALTO, we actually use NSAIDs more than we use opioids, which is pretty cool. So we use more ketorolac as our number one, basically treatment for pain as of last year. We also use a lot more ibuprofen. NSAIDs are great for pain, but they also have some significant side effects. So we just wanted to talk through a little bit of those. First, what do kind of NSAIDs decrease that we think helps with pain? Prostaglandins, great. So they decrease your prostaglandins by working on COX-1 and COX-2 inhibitors. Aspirin also has a big antiplatelet action. So aspirin, kind of, you take it, it's an NSAID that decreases your risk of having basically a clot, etc. But all other NSAIDs slightly increase it because they don't actually have a significant antiplatelet role. So, for example, when you take NSAIDs, we slightly increase your risk of heart attack, we slightly increase your risk of stroke, and then we increase your risk of GI bleeding. All of which sound really bad, right? So the big thing with this is that you should never be prescribing high-dose NSAIDs if you don't need them. So I think that there's a big kind of conception with our patients that if they take 800 milligrams of over-the-counter NSAIDs versus 400, that there's significant pain benefit from that. The answer is absolutely not. Every NSAID has a therapeutic threshold for pain, and with ibuprofen, it's 400. With ketorolac, it's between 7.5 and 15. And I'm trying to kind of re-educate myself and most providers that you should really never be prescribing more than 400 of Motrin. If you have someone with like truly inflammatory pain, like they come in with gout, right, which is an inflammatory condition, then I think there's a slight argument for possibly doing something a little stronger. But really, I think even with those patients, they don't really care about the inflammation as much as they care about pain control. So going lower is more beneficial. There's a few caveats. NSAIDs we don't like as much in old people. So what's a good kind of alternative that you can use, especially when they come with arthritis type pain? Is a topical. Yeah, someone said topical. So topical ketorolac is great, so diclofenac, so topical diclofenac I use on a lot of really sensitive patients. And then there's the last one. What's the difference between something like Celebrex and then like a traditional NSAID like ibuprofen? Yeah, so exactly. They're selective Cox-2 inhibitors. So they came out like a few decades ago with all these like selective Cox-2 inhibitors. And we thought, okay, we're going to have much less side effects because they're just Cox-2 inhibitors. The only one left of those is Celebrex. But the reason why we like Cox-2 inhibitors is because they're selective, they actually don't have as many gastrointestinal side effects. So you decrease your risk of having a GI bleed or having an ulcer from those. So if you have someone who's got kind of those risk factors and you think, okay, they might be at higher risk for developing an ulcer, you can still use Celebrex and think that you're being a little more safe with those patients. It does absolutely nothing to decrease their cardiovascular risk, though. Okay, NSAIDs. Yay, NSAIDs.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.